Hi, welcome to my presentation on K-cards as an intervention for central line associated bloodstream infections. So we're going to talk about a novel intervention for central line associated bloodstream infections. This intervention is called a K-card or Kamishibai card, which is an auditing tool that has been used in Toyota in Japan with a lot of success for helping workers on the line make sure that they check off all their boxes for what they need to do to complete their processes. So CLABSI, of course, central line infection, that is definitely a suboptimal outcome. And this intervention will focus on improving communication between the bedside caregivers and those people needing to audit their processes to make sure that all the boxes are being checked and that we are, in fact, covering all our bases to make sure that we are protecting our patients from central line infections. And the K-cards are going to help us do that. So let's find out how. So practice issues. Yes, they are unfortunate. Yes, they are suboptimal. Okay, so things that increase your risk for essential line infection, according to meta-analysis research. So the administration of TPN, of course, diabetes, yes, and also, interestingly, the presence of multi-lumen catheters increase a patient's risk for developing CLABSI. Kamishibai cards are shown to be effective in the literature for reducing CLABSI infection as well as increasing staff member adherence to recommended safety bundles. So also another point that's interesting to note about the TPN, they believe that the microorganism's affinity for dextrose is what increases the rate of infections for TPN. Diabetes, yes, we all know about how increased sugar levels in the blood, the bacteria, they also eat the sugar just the same as we do. They have the same cellular processes. Bacteria love sugar. We love sugar. So we can all share when we have an infection here. Multi-lumen catheters also, it just reduces the likelihood that the nurse is going to scrub the hub whenever she accesses it. So these things are extremely expensive to treat. So basically you could buy yourself a truck for $46,000 on average to treat per case. So yes, you could buy a nice truck with $46,000. 250,000 bloodstream infections are reported annually. So interestingly, maybe there are some that are not being reported. It might be twice that. Who knows? So 0.8 infections per 1,000 days of dwell time, and they are preventable. Pico question. Okay, so my patient population, I was thinking at the beginning of the presentation at the beginning of the semester that I would focus on patients with diabetes in particular, but now that I think about it, I think I could expand this to pretty much everybody in one hospital setting who gets a central line would probably qualify for a study like this. But, to keep this coherent, we're going to say that our patient population is diabetic patients receiving TPN in acute care setting. And, my intervention is the K-card auditing tool. So this K-card has a checklist of different things that you're supposed to do. You got to scrub the hub. There's a little box there for you to check that off. You're supposed to change the central line dressing every 7 days, or if it appears soiled, you're supposed to keep a cap on these things. So the K card in the room, the patient can also interact with this K card. So the patient is going to be partnering with the healthcare provider, yikes, in helping out with their own care to make sure that the bedside caregiver is doing everything that they need to do when they're accessing the central line. So, yes. Comparison. So we're going to compare this to a patient population who did not receive this additional literature, the K card, in the room. The outcome will be a statistically significant decrease in the CLABSI infection rate, and I'm thinking 3 months would be good because CLABSI typically appears within 48 hours of the placement of the central line. Diabetes and multiple comorbidities increase risk for CLABSI infection. Yes, we talked about that. So higher sugar level in the blood, bacteria love sugar, we love sugar, we can share, but if we share, we're going to get an infection. TPN and multilumin increase risk for CLABSI infection. Yes, so TPN has dextrose in it. Multilumins, there's lots of little things to manipulate here, lots of little nooks and crannies for us to get our germs in from underneath of our fake fingernails. They are going to find their way into that lumen. Yes, please wash your hands. And knowledge deficit amongst staff members. So, studies show that nurses do have a knowledge deficit. They need to know what the TPN is for, obviously, and there's a knowledge deficit in nurses understanding that they need to scrub these hubs and that they need to keep the caps on and that the central line dressing needs to be changed every 7 days or if it appears to be soiled. So these are the things that the nurses need to be understanding, and so we're going to have our patients helping them to understand these things now. Yikes. So K-cards, yes, they do increase adherence to the recommendation and they do decrease infection rates. So the interesting thing about this is there's quite a good bit of increase in the adherence to the recommendations, but there's not so much of a decrease that would correlate in the infection rates. So these things are very good at getting people to check off boxes, but the checking off of the boxes is not necessarily corresponding to a massive decrease in infection rate. So sometimes we're seeing a statistically significant decrease in infection rate, and sometimes we're not. But we are every single time seeing an increase in adherence to safety bundles. So what does this mean? Maybe it means that the CDC recommendations are missing something. These are reported to be a positive communication tool. So people when these are introduced in a non-punitive way, people report very highly favorably that they're able to partner with management in making sure that all the boxes are checked off. This has never been tested. The thing that's different about what I'm proposing and partnering with the patient and the patient's family members is that hasn't been tested with nurses yet, but we have seen in the literature that nurses respond well to interacting with management with the K cards. So the reason why this works so well is because this focuses on a process and not a personal failure. So if you miss something and there's something wrong with the process in which you're approaching the central line, it's not to say that you're at fault, you're not a bad person. It's not like, you picked up a piece of bacteria and put it inside the central line. It's just saying, you need to, maybe be a little bit more careful about making sure that the hub is scrubbed perfectly or the caps put back on. So they are a wonderful communication tool to help communication between bedside nurses and management. Recommendation, obviously, education, educate your staff, educate your patient family members on CLABSI. What does it mean? It's actually kind of risky to be admitted to a hospital. There's nosocomial infections, maybe we need to be more open about this with our patients. Educate your patients on what the K card means, how we're going to be approaching this audit, how we're going to be partnering with them and their family, how this is a non-punitive communication tool. It's just to help everybody. We want to incorporate this audit into the existing workflow. So we don't want everybody to have to drop what they're doing like hot potato, 2-minute rounds in the middle of your 10-minute med pass. Is a horrible idea. So we want to incorporate this into your natural workflow so that it becomes a conversation that flows naturally. Yes. Evidence-based practice in the interventions to be audited. Yes, we need to make sure that we are including interventions that are effective in the K-card audit. So what is missing? What's missing from this that the decrease in infection rate is not as much as the increase in adherence to the safety bundle rates. Like, what are we missing from our safety bundles to keep our patients safe? That's a good question to ask the CDC. Why are your recommendations not producing the same kind of results when we adhere to them? Establish a patient safety culture through non-punitive feedback. Yes, so we all value the safety of our patients. We want to see positive outcomes. And this helps the patient to partner with the nurses, with the management, with the hospitals. We want to bring these people along. We want to educate them. We want to have them feeling active and engaged in their care. So the K-card interventions gives them the tools and the word power that they need to be able to communicate their desire to remain free from infection. So, recommendation for patients, yes, look at your K-card, talk to your nurse, explain, thank you so much, nurse, for washing your hands before accessing my central line. Thank you, nurse, you scrubbed the hub. Thank you for putting that cap back on there. Healthcare providers, typically tend to be people who really, really care, and they take that burden home with them. If their patient gets a central line infection, nurses feel that. It's like they don't feel callous to that. It becomes part of their day. It affects their care. So we're gonna think about the nurse too. It's like we don't want to burn our people out. We want to empower our nurses to be successful. Taxpayers. So, oh my goodness, these things are so expensive. This raises the cost of care for everybody. We're getting reduced reimbursement rates at our hospitals. So, taxpayers are affected. Yes, hospitals are affected. It's like it affects morale. It's like, oh, we got a high CLABSI rate. It's like, you don't necessarily feel proud of that. It's like we're not posting this on Facebook, but so we want to make sure that we're doing everything that we can to make sure that our patients are safe and that we're reducing our CLABSI rate. So this is a good fit. The K-card fits well into the safety culture. It fits well into the patient's need to feel that they are a part of their care. It's feasible. These things are cheap. This is a piece of paper. We got lots of paper. We're printing off all kinds of reports and then throwing them straight in the shred bin. So yeah, just print some more paper. Totally feasible. Appropriate. It is appropriate. It fits well into the workflow. It's non-punitive, non-judgmental. It's appropriate to bring patient family members along. Patient education, that's part of our job. It's what we do. Educating them about CLABSI infections, it's very appropriate. Let's do it. So, yes, CLABSI, it is not inevitable. You do not have to have a CLABSI. You do not have to give your patient a CLABSI. Diabetes and TPN increase your risk for a CLABSI, but once again, not inevitable. They have been demonstrated in the literature to be well received and highly effective, and there's my references. Thank you so much for watching. Y'all have a great day. Thanks. Bye-bye.